Gotcha.
Thank you.
Alrighty, guys. This morning we are gonna go check on Sage. She's not feeling the best because she's a little lame on her back leg, I believe, and the vets have been giving her medication. So we're gonna go and check on her again this morning with the vet team and see how she's doing. Good morning. Hi, buddy. And then, of course, Dr. Jadina talked about Gordon being back for now. But yeah, he's back with us. They did a little check on how he's doing as far as like maybe allergies or something respiratory, but I think he's fine. And he'll probably be able to go back to one of the pet stores, but let's go in here and...
You guys gonna need Sage today?
Do what?
You guys gonna need Sage today? Because I didn't get her back in the pen.
I think they're taking a look at her right now.
She's out and about.
Okay. So it looks like Sage is back in the pasture.
Yep, and I'll get her back in here.
Definitely go out there and get her to move around. I'll go do it.
We're gonna go get her.
Yeah.
You ain't got deep enough shoes.
I can help in any way that I can. We're gonna go and see if we can get Sage.
Yeah. Your shoes aren't deep enough. You stay there. Oh, they're waterproof.
Yeah, but the mud is this deep.
All right. Well, I'll watch where I step.
This is shallow.
We're just gonna go ahead and run Sage into here. Squash, squash.
That's the one that comes in here. I'm gonna get wet.
Wow, it's like a river.
Climb along the gate. Oh, this is fine. She's moving.
It's like an obstacle course. Wow. Got Alan over there. I think they're going to come in pretty smoothly, hopefully.
Oh, everybody looks fine.
I'll move over here.
Do you guys want to see her walk more?
Well, Sage looks to be feeling better this morning.
Yeah. Thank you guys so much. I think we saw what we needed, and it sounds like it's an improvement. We're thinking about recommending that she be separated so that she can get daily medications more easily. I think that would be a smart way to go.
So you guys, was it last week that you guys noticed something was wrong, or the week before?
Last week they had mentioned that she was a little off in the back end. And so she got some pain meds, and then Monday she just did not look like she felt well. She was off, just completely off in the back end and looked uncomfortable, so she got some pain meds. Yesterday morning that seemed to help, so we just came out to reassess her and see if we wanted to continue those.
Gotcha.
She's a little tiny mare, and she's young,
and she's had really inconsistent training. So Alan has been wonderful with her, but she really, as far as fitness and training goes, hasn't had a lot of consistency because our gentler program is amazing, but we kind of are reliant on their schedules. And so I think that is probably a contributor. And then she was under saddle. She's been under saddle a couple times, but she's very, very, very reactive in a lot of circumstances. And so even if our team is really trying to be slow and gentle and take it easy, I'm not surprised that she may have caused some kind of soft tissue trauma in the process. But then also, you know, if we don't exercise regularly and then we have exercise, we do have lactic acid buildup in our muscles. And, you know, there's a lot of possible explanations. If Sage was a much less reactive animal, our team would have her inside our exam room and we'd sedate her a little bit and we'd do an ultrasound and take some radiographs. But catching and handling Sage is a big challenge, and cost-benefit analysis feels like may not be worth it because we discussed this morning we probably would have to put her under general anesthesia in order to get those diagnostics accurately, and that has inherent risks. And then also horses recovering from anesthesia, especially ones with a more feral nature, they tend to kind of panic a little bit more, and you know, horses can break legs in anesthetic recovery. So we're just kind of standing out in the rain and observing. She looks pretty comfortable to me in the field, and she very willingly cantered around and leaped over a little creek. And so I think we're going to give her some more days off from any weight-bearing exercise and some pain meds. I'm just rambling. Okay, just tell me to stop.
Thank you. You're good. Okay, Alan's gonna run his horse that he's working on today, and I think it's Zora. So we're gonna move for him. But yeah. Okay, we have Nita who's gonna get spayed. Hi, baby. She came in with a bunch of other puppies Thursday. Sweet girl, it's okay. It's okay. No, it's okay. You're fine. She's very cute, but very stinky. Yes, you stinky girl, but that's okay. So cute. You gonna go to sleep now? Hi, Nita. Oh, we got another one. Oh, careful, that's your nose. Go. What's this one's name?
This is Arthur.
This is Arthur. Hi, baby. You have a pretty color, too.
I'm a nervous Nelly.
Are you?
I'm coming. I'm coming. Hi, baby.
Hi, baby.
That's right.
You have the
Hi,
prettiest eyes. Hi, baby. So Miss Nita is asleep now, and Emily is prepping her for surgery. So she is shaving her tummy for the surgery site. Cute Miss Nita.
Oh, did I find an itchy spot? You just started kicking. Bigfoot. Bigfoot.
This one is great if you did this.
Well, maybe that isn't. Because it looks very new.
It does look new. I agree.
Alrighty, Miss Nita is on the surgery table, and Dr. Olivia is starting her surgery.
All right, so the way our anesthesia machine works,
is we've got our oxygen that's going to flow up through here, which has our we use isoflurane for our anesthetic gas. So that is going to go through there, kind of vaporizes it, mixes with the oxygen. Then it's going to run through down to the pet. They're going to get that. The exhaled gases are going to come back through, run through here, and then they go down into this little scavenger at the bottom, which collects all that excess gas and everything so that it's not just being expelled into the room, giving us any anesthetic gases that we don't want to be exposed to.
Okay, you're the one who found it.
I couldn't have found it without extending the incision, and what I should have done is just make the incision a little longer earlier, but I hate doing it.
It's okay. Happens. I'm sure closing your artery.
Nita is just about done with her surgery. Everything's going good. So little Arthur here is going to get his poke to go to sleep so he can get neutered. And Nicole is going to do that, so we're just waiting on her. And then he will be going to sleep.
Come here.
Puppy.
Hi. Come on.
He's sweet puppy. He's a little nervous.
Want to come out? No. Not really. Don't cry. It's okay, bud. You ready? Oh, goodness. Hi.
Good boy.
Okay, ready? Come on. Come on. This way. You're stinky. Look. Oh, bloop. There you go. You got it. He says, I do not have it.
You're okay, buddy.
It's okay.
You're okay.
Oh, you're just stinky. Yeah, you're stinky.
Just getting a little puppy.
Good boy. Good boy. That was it. Good boy. Okay, ready to go back in, stinky boy?
You can go back in.
You guys need a bath. Okay, ready? Oh. Good job, bud.
Good boy. Good boy.
Go to sleep.
And go sleepy bye. Be sleepy. Yeah. Okay. I'll let you go to sleep, okay?
Right, like they get taken outside.
So Arthur is asleep now, so Nicole's going to start prepping him for the surgery. He almost looks like a fox,
Yeah,
like that.
he's real cute. I think he will get adopted very quickly. That's why we picked him and his sister to go first, because Megan could only take 2. And based on their colors and demeanor,
Yeah,
they seem like they'd be the first ones.
very adoptable.
You guys are so fluffy though. Oh my goodness gracious. Alright, let's see here.
So for those that don't know, why is it super important to make sure that the area is shaved?
So we shave it and then scrub it down to make it as clean as possible. You don't want all these little hairs and everything to get into the surgery site because it can lead to infection. So we shave a little window around the testicles. Dr. Lydia does a pre-scrotal incision up here. So basically just need a nice little window here, clear of hair. And then we'll scrub with chlorhexidine scrub, alternating with alcohol. Make sure it's real scrubbed down because you can see all this like dirt and gunk he has on him.
Yeah.
So we want to make sure none of that is getting into that incision site. I usually do like one good scrub down beforehand, just to get the majority of the
dirt and everything off. And these guys have some poop on them because of their cage. They decide that it's a good idea to lay in it after. So make sure all that's off of there. And then you kind of do a little circle from the site out. That way you're taking any of that debris, bacteria, anything, and you're going from the incision outward to get it as far away as possible. That way if you end up getting some of this, you're not taking that back into the middle.
Gotcha.
And everybody kind of does this different depending on the hospital, the tech, the doctor. Some people will do like all the Chlorohex scrubs first, then all the alcohol scrubs. Then there are certain times you should be waiting in between the different scrubs. So like there's a contact time. I have not worked anywhere where we have followed the full contact time because it takes like several minutes in between each one. And as you can imagine, the patient is under anesthesia. You don't want to prolong that. You want to make sure it's clean. So as long as everything looks good, we do our couple scrubs and then he's good to go. So he is all set. They are still finishing up with Anita, so I'm going to give him some of his other things he needs, his vaccines and microchip and everything, while we're waiting, and then he'll be going in for his neuter.
Alright, Anita is done.
Okay.
Should need, because she got her rabies already.
Okay.
Just needs her rabies.
There is still a needle in that green fabric.
She's good to go.
All right, ma'am. I'm gonna roll you that way so I can pick you up.
Do you want to bring the neuter in here, or are we doing them in there?
Wherever you want.
I don't care. Oh, Dr. Gina. Oh, you're going to be so stinky.
Yes, sir.
Okay. Where are we going? Right here?
Yeah, that one's good.
Okay. And there's no side opening, so I really can't help you. I'm so sorry. This towel is still dry if she needs extra time.
Sorry, ma'am. Oh, it's not super cushiony, but.
There you go, sweetheart.
Ready? Yeah. I'll just keep this nearby in case you pee-pee.
He is on tape now.
That's it.
I didn't pull it up, so if somebody pulled it up, it wasn't me.
Arthur is being stitched up already.
For the other stuff.
Yep. And his surgery is just about done.
And has anybody heard from Megan?
I have not. I will text her.
Okay. If she's a ways out, we could go take rods on Toby and then come back down here, but I do feel like it's preferable to do stages of things. Okay?
Mr. Arthur's done. Yes, look at his little tiny, his little incision site.
So I heard that we had a couple people ask why we don't allow our cats and dogs at Horse Plus to be co-housed with one another. And there's a great answer for that. So for starters, I'm a huge proponent of appropriate socialization. It's so important for puppies and kittens to have age-appropriate socialization. What's difficult in a sheltering context is that we have mostly younger animals who haven't fully completed their vaccination and deworming protocols. And we have a lot to risk from both viral and bacterial and parasitic diseases if we allow young animals to interact with each other. And so we're pretty strict about that. And the reason for that is we don't want an animal to contract something from another animal here and then go home. We don't usually house cats and dogs at Horse Plus for a long time unless they're outdoor kitties that are all the way up to date. Most of our small animals get transferred out to outside organizations or to pet stores. That's just the cats. So yeah, that's the answer, is biosecurity and safety. And that's the same recommendation I give people who adopt a puppy or have a new pet in their household, is that if you have an adult, fully vaccinated dog in your home that's been dewormed and you know is safe, great. Let your puppy socialize with that animal, but don't let that puppy socialize with other unvaccinated puppies outside that puppy's litter. And we do sometimes, like if we have kittens from the same litter, we let those kitties stay together. But unless they come in, and same with puppies, right? If we have puppies come in from the same litter, we often allow them to stay housed with one another. But if they didn't come in together or are not related, or if one of them is sick, like this whole litter had tapeworms. And so those proglottids are shedding, and that poop is infectious to others until that infection is fully cleared. So that's why we don't let them hang out together.
Gotcha.
Sorry, this is far. Can't find out.
Hi, big girl. Sweet girl.
You're cute. You're gonna get adopted, dude.
Real quick.
Okay, Archer's done, and he's just gonna wake up now.
Then run these back up. Okay, I'm gonna wipe this with
So
vomit.
cute. So, I'm gonna grab Chester for Megan real quick, see if I can find him. He's usually in the vet barn around here. Chester! Kiki kiki. Hi, Chester! Sorry, I know you guys can't see. Hi, buddy! Okay, I'm gonna bring him to Megan, but he's in the little shed over here. You can hear him. Hi, buddy. Okay, I'm gonna bring you to Megan, okay?
I also checked Torty, also her incision looks great today, so.
We've got Tab in this carrier, and then Basket is in this one.
Look at Gordon is like, hello. He's making air biscuits above your body,
I
because
know.
he can't reach you.
He tries to hit me in the face all the time.
And then Gordy.
Yeah, you good girl. So you can see like there's a little bit still here, and that's okay. Like, but I would tell someone like she had to have a secondary
there's some
closure, and she had a little infection, and everything is going great. I would treat her like a normal cat at this point, but she's gonna have some more scar tissue that should remodel over time. Okay, good.
Jordan. An occasional cough seems to be normal for him now. So, but like, it wasn't anything
I
serious.
feel like I had like 3 more small ones.
They've never been in like a small space together, but like
Gordon is good to go.
they like each other.
So we're gonna try
Sorry, I
again.
just want to smash my hands.
Yeah.
Okay, we're gonna go load up kitties. She's got 4 cats. Hand to this one.
Thank you.
Hi, Gordon. Look at the adopted buddy. Doing good. Yeah, so earlier I grabbed Chester, so he's in here. And he is perfectly content. We just gotta get a carrier for you. Yeah. Hope he finds a good home. I think he'd be the perfect cuddly cat. He's definitely... He definitely loves attention. So she's taking a total of 5 kitties.
You're going on a trip. Come.
I know.
You coming?
This is your carrier anyway.
Come back.
He says no.
Okay. Come on, buddy. Okay, let's go put you in the carrier.
You're gonna go get a nice. Oh, I know. You're gonna go get a nice home. You can stay inside and sleep on all the furniture. You gotta go in there. Hi, Scoop. Move your butt.
There you go, buddy. Good boy. It's gonna be a short trip. It's okay. You'll be fine. Okay. All of them are in. Bye, buddies. Okay. There you go. Bye, Megan.
Bye, thank you.
Okay, now that that is done, Nicole has let me know that they're gonna take Blackberry out and take a look at her. So I'm gonna head that way. Whew.
Hi. I'm right next to you. Okay? I'm right here. I know. I'm right here. It's hard to hear out here, isn't it? Hi. You're okay. I'm right here. Hi. You ready? You can kiss around. Come.
Good job. Good girl. You got that. Very good girl.
Big girl, you're doing so great.
Good job.
Ready? Keep them forward.
There you go.
Good girl.
Good job, sweetie.
Very good job.
Oh, doing history. You're doing good girl. Your eyeballs look awesome.
Yeah. Hi. Yes, ma'am. What you hear behind you?
Very good. A lot of focus. Good girl. Very smart girl.
So, Dr. Lydia, why do we have Blackberry in today?
Yes. Blackberry obviously had her eyes removed. She's in here for a post-op recheck. Her eyes are looking great. We wanted to pregnancy check her. She's pretty young. And she came from a place that had a broodmare program, so we think she's had foals before. So we're gonna do a pregnancy check today. She came in with injuries on her back legs, and we didn't take radiographs. She seemed to be pretty stable, but we're gonna take some radiographs. We're gonna do a pregnancy check. We're gonna repeat her blood work. She had some mild changes on her blood work when she came in, so we're gonna make sure that that's resolved. And if all the things are good, then she's gonna get cleared to leave our hospital today and get some turnout time, which will be great. I don't think she's ready to go out with a friend just yet, but we're gonna give her some space where she can get a little bit more exercise, hopefully.
Eyes looking really good.
Part of a wound study.
Very nice.
I know, she's got all
My
kinds of
sweetheart.
just random.
You were such a good girl. We're taking radiographs of the left hog.
Okay. Good girl. Really beat yourself up. I'm not sure. So she's got a lot of irregularity here and also here.
Yeah.
This is the right hat.
That's chestnut, I think.
It's her chestnut. Yes, it is. Yeah, you're right. Joint spaces look okay from here. And then this, oh, sorry. Did I go too
fine.
fast?
I'm just looking up in this area.
All right, I'm gonna move on to carpus. I'm gonna start with the left. Good girl. Let's do the right thing. I'm gonna see if I can squeeze right. I hope it doesn't seem to be offering still. It's diagnostic.
And that front side is a little roughened too. Yeah, you got some.
So
some
see all
pretty
these little-
interesting arthritic changes, ma'am.
Little irregularities right there. So that's corresponding to kind of right here, where we have a lot of these ligaments kind of running down and inserting over here. So. You have a great personality to be a pasture buddy, though.
Mm-hmm.
I think those are some of our osteophytes right up here.
Yeah, thank you. That side looks a little
Irregular.
spot.
Yeah.
Yeah, and then down here looks a little.
Yeah.
Take your nipple
And your
over
fingers
gloves.
are like a centimeter in my primary beam, so move paddle a little bit more. Yes, perfect. Sorry.
No, that's okay.
Those gloves are.
It's hard for me to see where the Farrier
Yeah.
is over her
Quit
back.
doing that, please.
Those gloves are not the best.
Now rub your face.
I'm gonna drop your hand down. Yes. Add some patient movement.
You know, a piece of straw.
Does that look like a little fracture on you? Not here, obviously, but like running there. Maybe not. Looking at this, that little line right there with this little, this is normal. These little
Yeah.
weird spots up here is not fractures, that's normal. But this right there doesn't look completely normal. Okay. Girl. We're just retaking that same shot. Little tiny bit further caudal. Yes, perfect. That wasn't because the shot wouldn't have worked, it's because I didn't want to get your fingers in my hand. Yeah, now I don't see that line as much.
Yeah, might have been just.
Okay, let's do a little bit further back, like kind of right where saddle would be, and then I'm happy with fingers. Ready? And then, we don't anticipate that she's gonna have any dental pathology, but you guys wanna take
Might as well.
dental rats?
Sure.
Look at those beautiful teeth. I don't know why we have so much movement. This lube is super watery. And if you're doing, like say you're trying to,
It is new.
sweet,
Brand new.
Sweet.
Maybe it's not as watery as
say
the
you're
other
trying
ones,
to, oh, it's way better.
but- Yeah.
Say you're trying to like artificially inseminate a mare, you would use this kind because it's non-spermitogenic. But the J-Lube is awesome because all you have to do is add a tiny bit of water and it makes way more lube. So I really like having a little bit of this because then I can just add a little bit of water and I have like
Nice.
really, really good. Dr. Dean, I put that right in your way.
No, you're fine. I was gonna hand it to Nicole so she can
Oh,
do that.
yep.
She is. I don't think she likes being used as a brood mare.
She's not happy.
As soon as she starts to pick up her tail, she's put her ears back. Like, yeah, she doesn't like it.
Hand me the jug of lube. Oh, fantastic. Thank you for getting the lube.
She's not happy.
Okay, I know. You're doing good. They're all, I'm right over the colon, so that's balls up in just. I know. Thank you for being respectful. Good girl. Okay, now in front. This is all small intestine. Boop, boop, boop. I don't feel anything that feels like a rapid uterus. All of this is just like hoops of small intestine, just kind of like gurgling around. So essentially pregnancy, first thing you see is amniotic fluid, which is black, like a clear line and like really clear black.
Okay.
All of this kind of granular appearance with black beneath it is ingesta. I don't know what that is.
Did you colic before? It's like being an adhesion.
Right, like here's GI. That scared me. Here's GI. I'm feeling kind of straight down. I mean, it looks like scar tissue, right?
Yeah.
Like just hanging out right there. But it almost looks like surgical scar tissue.
Maybe we should call it.
It's really easy to find too. It's like pretty dark, but like this appears to be ingesta to me. All of that jagged, this is a totally different spot. She doesn't look like a C-section mare, but I don't know what those scars look like externally. Just moving on a little bit. Thank you for being so tolerant, man. You're doing great. Okay, thank you. I wish I was more confident with telling whether those areas of scarring and adhesion were gastrointestinal versus urogenital. I think somebody with more 100% experience could tell. But because they're so easy to find again, it makes me think that this is reproductive, right? Because if it's GI and it's just kind of like moving around, like look, I can go back to the exact same spot and have those exact same scars. So like this mare's reproductive tract is lying immediately below her rectum, and the fact that I can easily find them again makes me think that she may have some major scarring on the surface of that reproductive tract. So I hope we try this. Yeah, if we can't get it, we can open the thing, but let's try it with it closed. Good girl, you're okay. Right,
She's got an ouchy spot.
It's really looks quite rough.
Looks a little rough.
Can't tell much about up here, but
I feel like that's probably as good as we're gonna get up here.
yeah, it's reflective.
Want to try the other side?
Sure.
We could try flexing it. It's definitely rougher on the other side.
So she might have some elbow dysplasia maybe, or some elbow arthritis. But it's hard without getting extra views.
I think we should try with it flexed. I feel comfortable keeping her from biting and holding her leg up. If you and Nicole want to take the radiograph, I do think we're going to have to open the front. I will let Nicole know that when she's done. I'm going to try to pick this leg up so the elbow is flexed. Dr. Dean is going to tuck the plate in under the elbow. And I had to almost like kind of shoot down. It's not an easy shot, so if you don't get it, no big deal. Let me try to pick this up. Okay. Good girl.
Like there.
Yeah, just go for it. A little higher. Yes, do it. Beautiful. Good girl. Nice. That's a great image with no answers. Of course.
You want to try a DP?
Sure. I'll not let her bite you. You're a good girl. Ooh. Easy. Good girl. Good girl.
That edge is very rough.
Yeah.
And there looks, is there a chip? You see that little thing, opacity?
Right there?
Yeah.
Looks like it. Is that's medial? Yeah, that's the medial aspect. All right, big girl.
Sclerosis on the lateral aspect too.
Just a little bit.
So I'm just gonna go ahead and say I think it seems less and less fair to ask this mare to work. Like,
So pass.
she needs a loving, she's lovely to be around, you know? And she could have really tried to aim and kick today and she didn't, so.
So we are here with Blackberry. We just brought her in to do a recheck on her eyes, and Dr. Lydia wants to start preg checking every mare that we get, which is not a bad idea because we don't know what they're exposed to when they're at those auction houses and slaughter pipeline things. And then we decided to do some radiographs because her left hind leg has been pretty stocked up and none of the other legs seem to have been having any problems. She has a little plaque of ventral edema that's mostly right-sided on her this morning, ventral chest, and then her mammary chain on her left side is really firm and different than the right side. So there's a few different things that we're like, that wasn't there last time. So we did some radiographs of just the general kind of withers, carpi, and hocks, and we found that even though she's only 6, she has some pretty significant arthritic changes in those areas. And then right when we were about to do our outro, I was just kind of poking around on her because she had her elbows abducted in a very odd fashion, and usually horses do that when they have pain or they're kind of having some breathing problems, but she didn't look like she was struggling to breathe. So I just kind of was palpating around, and then she tried to bite me, which is very abnormal for her. She's not that kind of mare. So we took some radiographs, and on the medial aspect of her left elbow, we see what looks like a little bone chip and some roughening of that bone. So unfortunately, for how young she is, it's less and less likely that she'll be comfortable in work. So we're probably just gonna have to say that she's gonna be a pasture pet for some lucky person out there.
And then while we were pregnancy checking her, she is not pregnant, but she definitely looks like she's foaled before. She's got some scars on her vulva. She has an area that is consistent with, and I have to be careful how I say this because I'm not a radiologist by any means. I'm not great at ultrasonography, but our new ultrasound does pick up on really specific things. We got a great view of her left kidney, but she has some extensive areas of scar tissue, and it's a little bit difficult to tell. I was in her rectum using the probe to look down on where her reproductive tract would be, but also in that area is the whole rest of the gastrointestinal tract. So I can't confidently say that the areas of scar tissue were reproductive. They could have been gastrointestinal. What makes me think that it is her reproductive tract that had a pretty big area of scarring is that I was really easily able to find it again multiple times. And if it's in the gastrointestinal tract, you know, there's the omentum, so it has kind of this lacy connective tissue with the small intestine, but the GI tract is somewhat able to kind of move around itself, so it's often really difficult to get a GI lesion again in a horse. And this 3 or 4 times, just right when I was in that area, I was able to see it. So it does look like she may have had some trauma to her reproductive tract. She's got a lovely personality. She's super smart, really aware of where you are, very, very easy to please, but she did not like being rectally palpated. And so often brood mares, the more you work with them reproductively, the less they care. You would think that it would be very invasive, but rectal palpation in horses usually, especially mares that have had foals, are fine with it, you know, once you kind of get past the first, what are you doing back there? And this mare definitely at multiple points was like, nope, I do not like this. She was very respectful. She was never dangerous. But that also makes me feel like she may have had some kind of reproductive trauma from her history. She was already microchipped, so we were able to trace her back a little bit. So we know that she was in a program that breeds horses. And she is a branded standardbred, right? Nope, she's not branded. She just had a microchip. So we know that she was in a program that was breeding horses and also in a context where she might have been used as a teaching horse. So also a cause to not enjoy being palpated if you've had, 50 students trying to learn something. Sometimes that can create a traumatic experience. But overall, I'm thrilled about how her eyes look. We're rechecking her blood work today. She had a little bit of icterus on intake day, which can be incidental, but also could be significant. So we're rechecking that and running a full CBC chemistry and just making sure. But also we want her to have more space. So she's been in a stall in our veterinary hospital for a full week. She had surgery a week ago today. Feels like longer than that. And I would love for her to be able to walk around a little bit more. So we have a smaller quarantine paddock where she would be by herself, but she'd be able to smell and hear. I almost said see. She will not be able to see the other horses in quarantine. So we're hoping to get her out, although it's really cold today and just pouring rain. So we might put it off by a day until it's not so gross outside, but hoping to get her some exercise. And she's a really special horse. She listens really intently and is great to work around. So I'm hopeful that we find her a special home.
So behind that blue tarp is a giant check that is going with Jason and Tawny to Colorado tomorrow. And Keith just wrapped it up and is safety proofing it so it doesn't get dinged, dirty, or bent.
Or wet.
Or wet. It is raining cats and dogs literally outside today. And of course, well, I was in a meeting, so I did miss the beginning of this effort. So you will just have to take me and Keith's word that there is a giant check under there.
Yes, there's a giant check. But it's very nice.
Yeah.
It is very nice.
It's very nice. Not the easiest thing to cash, but
Oh no. Yeah, that will be hard to cash if you carry it into the bank. They might laugh at you.
well, you definitely can't deposit it at the ATM. So.
Oh no, definitely not. So, me and Tate don't get along.
Here in a few hours, Tawny and Justin and I are heading to Colorado to give Carrie a very special gift. One of our longtime supporters, well, anyway, they left a property to us, and part of that was to help Carrie out of Colorado Horse Rescue Network, and we're going out there to give her the big check, which Keith so graciously wrapped up this morning for us, because it's raining, it's pouring rain. I've got my camera gear ready because obviously we're gonna document this event. This set has been with me on many trips all over the country, helping horses, and I guess it's gonna go one more time, at least. Of course, it's gonna be a lot more. But I'm packed up, I'm ready to go. I'm gonna go get the truck ready and get the trailer hooked up. So we're leaving like 4 or 5 a.m. It's gonna be a long drive, 17 hours of driving, straight there, with a stop to sleep.
Oh, I thought you meant Buc-ee's.
And a stop at Buc-ee's. Not sponsored.
Coming out of retirement. For one horse. You know what they say, Alan? Older the violin, the sweeter the music. Man, I tell you what. What's this horse's name?
I don't even know.
I don't even know. What kind of name is that?
That's his name for me. I don't know.
Now, I watch this thing now. He might be a little jumpy.
Okay.
He said, okay. You did what?
Shekinah's going home tomorrow.
Okay. Well, we'll clean her up here, make her look like something. Won't take but a minute. Horse Plus, man, this place has really grown a lot. A lot of things went on. A lot of additions. mean,
I don't think anywhere else gets any hotter than Arizona.
well, I hope this passes your inspection. I learned this off a YouTube video I watched one time. There's a guy in Arizona.
Yeah, that's the thing about people. They watch too much TV and they say they learn off TV.
Well,
I learned on my own.
There was a guy out in Arizona. His name was Alan. I was watching him.
Oh, man. You ain't gonna learn from nothing from that guy.
I think he moved to Tennessee. I'm not real sure what happened to him.
You're in trouble.
What do you think, Alan?
That's right.
Is that right?
Look a lot better than it was before.
Well, you're the boss.
You're cutting into my lunch time now.
Y'all take lunch?
That's right.
What?
This one's got to eat to do anything around here. If you don't eat, you ain't doing nothing around here.
I'm just amazed how healthy these hoof walls are. This horse has really got good feet. A little thin on the frogs, but that's normal from being barefooted. It's not the end of the world. Really solid. A lot of people want to fight them, and they'll also take their stand and jack their feet way out, which rolls their hip up in them, and that makes them uncomfortable. But I like to tuck them in so the horse is comfortable.
Yeah.
So we're parallel.
Yep.
That's just like when I'm around it, I stay square to this horse, because that horse looking straight ahead can see the side of his foot back here. But if I get like this, horse can't see me as well, so he'll turn his head. When he turns his head, he turns his butt away. So as long as I stay square, he doesn't move around as much. Makes my life a little easier sometimes. But the more you do it, the better they get. Okay, I'm gonna get on the other side. You spin him around.
Turn back this way.
There you go. This side over here is a little longer than the other one. We'll take some of that off. Even her up a little bit. It's not really just for looks. It does a purpose. It makes this outside strong as well. Makes it grow strong. That's what we want. Good. Good. What's a pretty horse? Got a good coat on it too for winter.
Yeah.
Somebody been feeding this horse. Y'all feed horses here? Or y'all just keep them? You don't feed, you just trade them.
That's right.
Well, somebody been feeding it.
Yeah, somebody's been feeding
it. It looks good.
Yeah,
Got a shiny coat on it. Yeah. So that turned out good. Yeah. Yeah. Man, this vet barn is so nice. This is nice.
Oh man, that was good.
Hey, you did good.
All right.
Couldn't have done it without you.
Oh man, you could have.
I don't know, Alan. You're pretty good at wrangling these horses.
Everybody could do without me.
You look pretty important to me.
Oh man.
Well, hey, look here. Let me close with this. All right, here, turn right here. Look at the camera.
I'm not kicking. Be
Hey,
careful. Don't walk behind me too much.
You're gonna be famous.
One of these days.
Out here with Alan today.
That's right.
He's my man from Arizona.
Yeah.
Come out here. You talking about working a horse? This guy is the horse guy.
That's right.
He is the horse guy.
Always going to be.
Thank you for what you do out here.
Hey, thank you for coming around and taking care of that
these
horse.
horses is hard. It's tough.
It is.
You know,
it's also dangerous.
It is very dangerous.
Yeah, it is.
And take the patience and time you do. You're doing a fine job.
Thank you.
Takes a lot.
Thank you. It does take a lot.
Look at it.
Yeah. So much for being pretty. Now you got shavings all over you. I think she likes it.
Almost done colored the floor here. I make a cut out of it, you spoil them.
That's what I do with my horse. You're
supposed to make them work, not keep them as a pet.
My horse is a big time cow horse. He's bred a cow horse.
See,
you know,
you're making that horse work.
I got him trained.
That's what horses are for work.
I got him trained. You know what he'll do?
What?
I shake a feed bucket, I dump it in the trough, I go back inside. He eats it all.
That's good.
Every time.
I hope so.
It took me a... But I
like all horses. I don't care how big they are, how small they are, they're all nice.
Well, I trained this horse to eat out of a feed bucket. Hey, took me a while. I had to shake it and beat on it, rattle it, dump it in there. Now, every day when I walk out there, boom, 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 here he comes, boom.
That's what you call spoiling the horse.
Got a little thin frog, but that ain't nothing major. That's just a... Yeah, that ain't nothing. That ain't no big deal. We wasn't doing a whole lot today.
Because of the rain?
Yeah, rain kind of slows everything down. But, you know, that's the way it goes.
Well, we're super excited to have Sydney.
Well, I think she'll do all right, you know.
Katie's from Ohio. She drove here to work. Yes, I did.
Ohio.
She knows you. She watches all the videos.
Well, you know,
the episodes.
that really wasn't me. That was good editing, and you know, that really.
They do a good job, don't they?
They can make somebody look good.
They
So,
do a good job.
yeah, I'm really a nobody. I don't know much.
Oh my God.
I just show up.
And humble to boot.
Yeah.
We all know better.
Yeah, I mean, you know, I kill them with kindness. So.
I think, you know, you're a pretty genuine person, and I think it shows.
Well, I mean, I can't really fake this. It is what it is.
It is what it is.
You get what you get.
About it, right?
I mean,
it is what everybody here, very genuine people.
It's a unique place. You see so many different types of horses, sizes, dispositions, the whole 9 yards.
So many crazy. I'm sure you see a lot of the crazy feet, a lot of the stuff that comes in, things you wouldn't see anywhere else.
Well, when you're dealing with these animals, you know, you've got some that's been neglected, some that just weren't able to take care of them. There's a lot of different situations and scenarios they come from, but all in all, you have to deal with all of it.
Yep.
And having that mixture makes it a challenge.
Yep.
Nothing's the same. It's always something.
Something new all the time.
Fortunate enough, though, they've seen enough now, they can pick up on a lot more than just starting out.
Yeah.
You know, when you're just starting this, you don't know what you're getting into. Now it's like, okay, we've got a better grasp on it, and they're doing more. Yeah. So, and that's how it works. But that's with anything. But you know, I was here when it first began, and it had been here a couple years. But I come in, and it's really grown with the buildings and all, and everything that they're doing. So they put a lot of time and effort in it. It's really growing.
Fast and getting bigger every day.
You know, to have this many horses come through in a year, it's a lot.
It is a lot.
I know.
That's why we're here, right, Sydney? Exactly. We're gonna help them get these horses adopted.
Get them out of here. Get them a home.
Get them a home. That's right.
Well, maybe we can get her to do something. I don't know.
We're so excited she's here. I can't even tell you. We're so excited. You got a pretty special kid there.
Well, don't let her fool you. She
There's some fire in her. We see it.
She knows more than she acts like she does.
Oh, we see it. We see it. That's why we're excited.
Shekinah's going to Colorado tomorrow. They're leaving out, taking her back to her owner. Her owner got sick, and Tawny told her, "You get healthy, let us know." And she's healthy again, so she's going to go back home.
Well, that's just another story right there of success, that the horse came here and now it's going back to its owner.
Yeah.
So that says a lot for Horse Plus, you know.
Full circle.
It wasn't really, well, you've sent it here and that's the end of it.
Right.
And that just says a lot for them.
It does.
So, you know, that's a lot of integrity there, and that means a lot.
It does.
So.
They're driving up there, straight there, and then coming, but that's over.
You've been
in
to
Colorado.
Colorado.
That's
36 hours.
Yeah.
I think she said.
Yeah, it's a haul. there's different places depending on where you go. We go out to Meeker every year, and it's about 25, 26 hours for us. So, and that all depends on what the weather conditions are.
Right.
you might be stalled for a while somewhere.
Right.
But anyway, it's good to be back at Horse Plus. Good to see everybody. Hey, you guys keep watching the show, watching their videos, whatever they do. I stay out of the way. I just get in the way is all I am. But good to be here. Good to see everybody. Keep supporting them.
Well, guys, he's got a very fancy blanket on, but this is our last night with Shekinah. He is off tomorrow morning with Tawny and Jason, and they're leaving pretty early, like 4 in the morning. So this is our last little look at him. I can't get too close because I was up in quarantine. So I'm just gonna open this and say goodbye. Goodbye, buddy. Love you, buddy, and have safe travels, and we're glad you're going home.